Hi, my name is Siobhan O'Connor and I'm a researcher working on the Dallas evaluation. And what I'm looking at specifically is how to successfully engage patients, carers and health professionals in different types of digital health technologies and that are specifically targeted at kind of consumers really. And I'm part of a large research team at the University of Glasgow who are working on the Dallas evaluation, and that's been led by Professor Francis Mair and Professor Catherine O'Donnell, who are based in general practice and primary care. So I suppose just to give you some background on the Dallas programme and kind of how it got started. As we all know, the demographics and health of our society is changing. There are growing numbers of people with one or more chronic conditions and ageing populations, which is putting kind of large pressure on the health services. So people are starting to look towards digital health technologies to kind of encourage more preventative care and more self-management in the community, in the hopes that that will kind of improve health outcomes, I suppose first and foremost, but also reduce health service utilisation and cost in the long run. And Dallas stands for Delivering Assisted Living Lifestyles at Scale, which was a UK-wide digital health innovation programme that was funded by the UK Technology Strategy Board. And I suppose what Dallas was trying to do really was address some of the problems I just mentioned by kind of moving away from small-scale pilot studies or randomised controlled trials and really scaling up the use of different kind of person-centred digital health technologies and really get them out there into the real world. So it started in June 2012 and the main aim of Dallas really was to reach and recruit more than 160,000 people over a 3-year time frame. So Dallas is quite a large, complex programme, but very briefly it kind of consists of 4 groups or communities called Living It Up, which is based here in Scotland, Year Zero, iFocus and More Independent. And each of those 4 groups are kind of made up of a large consortium of different stakeholders, and that includes NHS trusts, private industry, organisations from the voluntary sector, and local government agencies, and in some cases academic partners as well. So there's quite a large group involved. And as well as that, they're developing and rolling out a whole suite of different digital health products and services. So anything from telehealth and telecare systems to mobile health apps, online portals and electronic personal health records and assisted living devices as well. And they're implementing those in both rural and urban regions of Scotland and England. So Dallas had quite a large geographical spread as well. And I suppose from my own perspective as a nurse, I often experience a lot of barriers when I work with patients or even among my own nursing colleagues when I try and engage them with these different health technologies. And so I really wanted to explore the digital health engagement process in Dallas for my PhD because it's not a very well understood area. So most of the kind of health informatics literature around implementation at least is kind of focused on clinical information systems in more acute settings, whereas now most of the technologies are more patient oriented. And in general, the kind of e-health implementation literature has looked at how the technology is used by different groups of people, whether it's patients or health professionals, the efficacy of the technology improving health outcomes, which is the big one obviously, and also how to implement the technology in different organisational settings. But I suppose while all those things are really important, we don't really understand about the beginning of the process around how ready people are to adopt these technologies and how to reach, engage and recruit them to using the technologies. And this is what I'm interested in as a nurse. So my case study looks at the factors that helped to successfully engage different stakeholders in these digital technologies as part of the Dallas programme. And I got ethical approval to do a secondary analysis on 37 baseline and midpoint interviews that were done with different people implementing the technologies in Scotland and England. And they were kind of a mix of people from the NHS, staff from some of the private industries involved, and some volunteers from some of the local community organisations and some of the academic partners as well. So we also looked at some project documentation and we put all that data together and analysed it using the framework approach, which involves basic thematic coding and synthesis. And that kind of came up with 5 kind of overarching themes that really facilitate e-health engagement, and I'll kind of talk about those in a bit more detail. So firstly, a variety of community engagement strategies were rolled out by the 4 Dallas communities, which really helped reach patients and their carer network. So for example, market research was used in the beginning to identify specific consumer groups and create personalised strategies to reach them. So a telephone advice line was set up, which people could ring and get tailored information about what technologies were suitable for their personal circumstances. Financial incentives were also offered, such as discounts on some of the assisted living devices or free installation of equipment. And quite often, people who adopted the technology early on became user champions for the digital platforms. And this helped create buy-in from their formal and informal carers. And then finally, existing networks that were already present in local communities were also used, as this health service manager explains. She says, there are things like health trainers. You know, we don't directly commission the health trainer service, but what we do is we augment it with the ability to understand and know about the technology that's occurring. So then another important aspect of engagement was the quality of the technical design. So some of the Dallas communities used like a co-design methodology, which involved creating the digital applications with end users, and that really helped create something very tailored for people who really wanted to engage and use it. This participant describes it well. She says, by basing it all around co-design and working with the communities to develop it, it's got to be innovative, otherwise we're just making another website. So if we keep going with that process, then I think it could be something that communities really use and want. And other useful technical features then included having an integrated digital login, so people could use their Facebook or Google accounts to register on a Dallas product or service. And also some of the assisted living systems were kind of as automated as possible, just to make it easy to fit them into people's everyday lives. And that was one of the reasons people enrolled and started using them. So then another factor that helped people participate in Dallas was the work that all of the groups did around improving digital awareness and accessibility. Because we know that the digital divide exists in our society, and if we're going to introduce all these technologies in healthcare, then we really need to make sure that everyone can afford them and that they have equal access. And Dallas has done a lot of good work in that area. So for example, in Liverpool, they've rolled out a Digital Champions programme, and they've launched over 50 digital hubs across the city to give people in more economically deprived areas better access to computer resources and also to digital literacy training. And that's really helped people to get online and raise their awareness and understanding of different types of digital health products and services. As this voluntary partner commented, he said, most of the communities in the city are in existing places where people go, in church halls, libraries, anywhere people could go. If we can get a computer in there from Union Learn and with a digital champion to help them use it, then that's what we're really targeting, and that's overcoming the barrier for access. And then other initiatives like working with retailers to stock some of the assisted living devices, and they also launched an interactive online and physical smart house. And this is a show home in Liverpool that people can go in and see how these technologies can be used in everyday life. And they're really helping to improve awareness and accessibility for people, and that'll ultimately help them engage with a digital health product or service. So now moving on to how different health professionals became engaged with the Dallas programme. Clinical champions really have become key not only to getting large numbers of patients on board, but also to encourage other practitioners like GPs, district and community nurses and so on, and really get them to participate, because if you have a senior person who's very well respected and really advocates and promotes the technology, then that makes it much easier for others to sign up to try it. As this health service manager describes, she says, so there's definitely an interest from the medical profession, particularly GPs, and saying how might living it up help with the kind of social prescribing. We have communication on that basis. I think ultimately there will be very good champions for this going forward. And as well as that, then successful demonstrator projects and training healthcare staff to use the different digital platforms to improve clinical engagement. Financial incentives were kind of also discussed, like linking the promotion of technology to GPs' QOF targets, but that wasn't implemented because I suppose that's a bigger issue that would need to be taken up at a national level about whether or not that's really appropriate or not, because there's lots of ethical and legal aspects to it. And then the last theme that really facilitated engagement was the e-health capacity of some of the NHS trusts. So for example, those that had digital health strategies or policies in place already, or whose staff were using electronic health records or mobile devices, they were much more engaged and much better able to participate in Dallas because their clinical staff were digitally enabled, and they had the right technical infrastructure in place to support the different technologies. Like this partner acknowledged, he said, they're much further developed in terms of their own digital strategy as an organisation. So their staff do mobile working, they have tablets, and they're digitally enabled. So it's clear that engaging people in person-centred digital health technologies, it requires lots of different elements to be successful. And I think we can learn some really valuable lessons from the DALAS programme. So the most important aspect that spans both health professionals and patients, or just the general public, is really to improve awareness and accessibility of different digital health products and services. So initiatives like providing e-health education for clinicians and digital literacy training for patients and the general public should be used. Both clinical and user champions, I think, is another good way to get people on board. And also digital hubs with computer resources and high-speed broadband is essential to tackle the digital divide and make sure that everyone has equal access. Then from the patient's perspective, to get them involved in e-health, it's important, I suppose, identify your target audience and for a particular technology and design personalised recruitment strategies to reach them. As well as that, sort of collaborative grassroots approach through community organisations can also improve engagement, as can co-designing certain technologies to meet the needs of specific groups of people. And then finally, from the health service perspective, a lot can be done as well to improve clinical engagement. So introducing or updating digital health strategies and investing in IT infrastructure, as well as possibly incentivising e-health engagement, could encourage many health professionals to sign up to use more person-centred health technologies. So I hope that's kind of given you some useful insights into the digital health engagement process and what's needed to be successful and get different groups of people to participate. I suppose just to highlight some of the limitations of the case study is that we only spoke to people implementing the technology and not to actual consumers or end users. And unfortunately, we didn't have access to people who chose not to participate and take part in DALAS, so we're missing their opinion as well, which I think would be really valuable. But we're currently doing interviews and focus groups with end users like patients, carers, health professionals, to kind of get a more well-rounded perspective. And we're also following the UK Medical Research Council guidelines in relation to complex interventions. And we're using a theoretical framework called normalisation process theory to kind of guide our understanding of sort of readiness, engagement and recruitment, which are kind of important aspects of e-health implementation. So hopefully we should have a much better understanding of the whole digital health engagement process in about 12 months' time.